I'm Christopher Phillips with CNB Wealth Management, and today we have with us Travis Havens, President and CEO of Hospice of Lenawee. Thanks for coming.
Thanks for having me, Christopher. Always great to be here with County National Bank.
Well, today we want to talk a little bit about hospice in general, but our main topic will be with the 5 wishes. And Holly Baker said 5 wishes plus 1, so we'll let you talk about the plus 1 in a little bit.
Absolutely.
But tell us a little bit about, if you could just, most people are familiar with hospice and have experienced it in some way, but maybe for those who are not as familiar with it, could you define what is hospice?
Yeah, great. That's a great question, and sometimes that word is just a little bit taboo. You know, when you mention the word hospice, people can get a little spooked by that, or just talking about end-of-life care in general. And so we really want to educate the community, make them feel comfortable to have these conversations. That's what 5 Wishes is all about. Hospice care in general is really a tremendous service that we have so many people in the community that say to us, Christopher, that they don't know how they would have navigated their journey without our support. And so hospice really entails end-of-life care that is really nurse-driven. It's a Medicare benefit that is supported by Medicare and Medicaid and other private insurances, but it's really where an extremely unique, highly trained group of healthcare practitioners come in to surround the patient and their family and give them the support that they need to make sure that they're comfortable and that their wishes are met, that their needs are met toward the end of life. It is not something, however, that once you come into the care of a hospice provider such as Hospice of Lenawee, that your time is very near, or it's going to happen tomorrow or the next day. And we certainly don't hasten that process. We come around the patient again and their family and support them for weeks to months, and sometimes even years, depending on the situation. So people always say, when should we call in terms of hospice? And people also feel like, well, when I call hospice, I'm giving up. It's not like that. We always tell people, call sooner than later. There's nothing wrong with calling us, even if you're truly not quite ready yet. Or we actually, our nurses and our physician are trained to come in and support and then make sure that you would qualify for that Medicare benefit. So a lot of people, when they call us, they truly don't even qualify quite yet. And so what we do is we have a team of nurses, our admissions team, that follows the family and the patient for however long they need until the patient is ready to come into our care, and then we do that start of care. So sometimes we talk to people for months or even a year before they really even sign into our care, and there's just no pressure that way. Our nurses come down, sit down with the patient and their family, and teach them, here's what we can do to support you, and if you're not ready, what we're going to do is keep checking on you until you need us.
Yeah.
There's no high pressure. They're not salespeople. They're nurses. Nothing wrong with salespeople.
Right.
Just saying they come in and just teach about hospice until the patient or family are ready.
So when you talk about Medicare, when we think of Medicare, we usually think of the benefit that we receive once we're 65. But in this case, it's not necessarily limited to those 65 and over. It could be eligible for any age. Is that correct?
Yeah, absolutely. So our team helps with the ins and outs of that as well. And so there's different scenarios in terms of how people are supported by, and then how the care is paid for. Very rarely does somebody have to pay out of pocket for hospice care unless they're in our hospice home, and then there's a daily room and board rate, which again we come alongside and support families, and we never turn them away based upon their ability to pay. But yes, it's a Medicare benefit, so you think anybody after 65 is eligible for a Medicare plan, but also those with life-limiting illnesses can qualify for Medicare. So every now and then we have somebody that isn't eligible for Medicare with their age or their condition, or Medicaid, because that's need-based based upon their financial implications. Then typically private insurances cover that hospice benefit as well. And then sometimes somebody falls in the gap of all those things, but they still need our care, and that's why, because we're part of such a generous community, we are a nonprofit, 501(c) at Hospice of Lenawee, and so we go out and ask for support, and when we get that support, we can put that into providing that care for people that are unable to pay for or don't have the insurance for that. So we have the Hospice Heart Endowment and we provide charity care as well. So
That's wonderful.
that's another myth that we're always out there, breaking in the community. People say, I don't know if I can afford it. Well, there's so many different ways that you can get that support, and we are experts at navigating that with that family, coming alongside them in
Definitely
that
worth
journey.
a call to see if there's a way to make that work. And you touch so many lives in this community and so many families, so you guys know how to navigate through that process.
We do, yeah, 4 decades of service, and so it's been our honor to do that, and we couldn't do it without the support of the community, like I alluded to. So yeah, it's an honor to walk along these families.
Okay. Well, we'll go ahead and jump into the 5 wishes. So tell us a little bit about the 5 wishes in terms of, maybe we could just go through the 5 wishes in order and talk about what it is. And so basically it's an advanced care directive, is that correct?
It is, yep, Chris, and it's the first one that really talks about your personal, emotional, and your spiritual needs. So it's really all-encompassing rather than just setting up a power of attorney or a patient advocate, or so it's really all-encompassing for the patient, the person. I shouldn't say patient, because you should be doing this way before you'd be considered a patient. It's for anybody that's 18 years or older, once you're able to make your own decisions, to set this up in case something happens and at some point you're unable to make decisions for yourself. So we do a lot of educational series out there, and the 5 wishes is one of our favorite topics, and it's one of the most important ones, because again, we're trying to help people understand that it's not scary to talk about end of life. It's okay to make these plans. In fact, the earlier you make them, the better for you and for your family.
Yeah, we have these conversations with our clients all the time when we talk about estate planning, and part of estate planning is dying. And so before dying, you usually need someone to help along with some of those decisions.
Yeah.
So this is really good information for our clients.
Yeah. Christopher, one of the things that I think probably the most common thing we hear out of the people that we're serving is when that time comes, I don't want to be a burden on my spouse or on my kids or on my family. Well, one of the best, we call it, it's really a gift that you can give to them, is to make your wishes known and make your decisions and have it laid out for them. That way they don't have that tremendous burden of making decisions for you without having had that conversation. Some of the worst things for a family is to not be prepared and have things set up to where then when there's a crisis, they're having to make very difficult decisions and they don't truly know what the person wanted, and then now they're at that point that they can't make those decisions, or maybe they're not conscious to make those, and that's a tremendous burden for the family. They're always wondering, did I do the right thing? Did I choose what he or she would have wanted? And one way that you can make sure that you're not putting that family in that situation is to execute this 5 wishes document well ahead of time.
That sounds great. So what's the first wish?
Yeah, so the very first wish is you're making the decision of the person I want to make decisions for me if a time comes that I can't make them for myself. And people should really think about that. And again, it kind of forces some conversations with the people that you're close with. And sometimes you just think that that's automatically your very next of kin or your spouse, but really sometimes that's really not the best person. We've seen that happen where somebody chooses their spouse and they set their wishes, but the spouse has a very difficult time putting your decisions in place because of it's painful for them or emotional for them. So you really want to have conversations with people that know you, that care about you, and make sure that you choose the right person that you know will carry out your wishes if you can't make those decisions for yourself.
Yeah, my mom would always say that my sister was going to be making those decisions because she knew she could, quote, pull the plug if needed to, and me and my brother couldn't do that. So,
Yes.
so you want to, and not only the person that can make those decisions, but also someone that I would assume aligns with your sort of same beliefs and understands your beliefs, and I'm sure the rest of the wishes will kind of go through will explore what your wishes are.
Yeah, absolutely. Yes, and it goes right into there. Once you've chosen that person, you've had those conversations, then you go into that second wish, and then you're laying out in this plan what kind of medical treatment that you want or don't want. And the document is just so easy to use. It really lays it out for you that if you're in a certain situation, you want this, or you don't want this. And specifically, it talks a lot about life support. And people are like, wow, that's a tough decision to make. And it is, but that's why it's important to have these conversations. And then it lays it out for you to say, like, okay, yes, I would want life support if I'm making gains or making progress. But if I'm having life support and I'm not going to get better, then I would want that life support to be removed by my physician. And so it really gets into that much depth that you can talk about with your loved one and make those decisions, and again, have it all set ahead of time.
And again, what a great conversation to have. So when the family's in that midst of those trials, with the stress that all that comes along with it, they're not having to make those decisions, but can rely on your words and your signature and know what you wanted to be done.
Yeah, absolutely. And it is something that I didn't mention earlier, but it is a legal document, and it is legal and binding in 46 of the 50 states. So there's just 4 states where I would still recommend people in those states to execute that. There's a next step that they have to take in those states, so they'd want to check into that. Ohio is one of them, since it's kind of close to us, that we mentioned to people that look into that next step that you have to take. But here in Michigan, it is a legally binding document. So you're laying out these medical wishes that people should be following once this is properly executed.
Great. So we've identified who we want to make the decisions. We've told them kind of the level of care that we want and when we want care to sort of slow down. What's the next wish?
Yeah, so the next wish is, how comfortable do I want to be? And it's definitely something you want to have conversations. People are like, well, of course we all want to be comfortable, but there's really different levels of comfort when it comes to, some people, based upon their cultural or their religious beliefs, don't want to have certain medications or procedures utilized. And so this gives you the opportunity to go through that and say, I would want this, but I don't really believe in this. And so that's important too, that you're making that decision, because when that time comes, sometimes families really struggle with the level of comfort or the interventions maybe that a hospice provider such as us would provide, because certain medications have, make people more sleepy or groggy than others. And so that balance is tough for the family, because they say, well, I want my loved one to be comfortable, but I want to be able to have these conversations with them. And sometimes that's a fine line, and that's why we really recommend hospice care, because we can come in. We have a double board certified physician, Dr. Justin Voorhees, and he is board certified in hospice and palliative medicine, and so he can help with balancing that and teach the families, if we do this, then your path looks like this. If you'd rather have that, then let's look at this route. So, but when you're well of sound mind and not in crisis situation, that's when you should set this up and make sure your family knows what your wishes are.
And it allows the person to go through their journey with dignity and with clear-mindedness in advance of the time that this is happening. So
absolutely.
Great. All right, so we've got 3 wishes. We've got 2 more to go. The next one is how I want people to treat me.
Yeah, so this is a great one, Christopher. It's really, how do I want the people around me to respond to and or support me during this time? So everyone likes things a little bit differently, and that's why you should tell people what you want ahead of time. When your moments are near at the end of life, do you want someone sitting next to you, or do you prefer to have some alone time? How many people do you want around you? I mean, some families really kind of flock in, and depending on the individual, that's great. They want all that support, but some people, this is a really intimate time. Maybe they just want a couple of certain people next to them during these moments. And so again, no better time than now, when you can really think about this and process that to make those decisions. The other thing about 5 wishes that's so great is that once you put it in place, it's not final. You put this in place and you can change your mind. You can update that document anytime you want. So if something in your life changes, you can just update the document, and we'll talk a little bit more about who should have that at the end, but you can always change your mind and update this document.
Perfect. So the 5th one is I want my loved ones to know.
Yeah, so what do I want people to know that are supporting me at the end? And, after my time has come, what do I want them to know? How do I want to be remembered? And it really allows you to lay out your wishes for your funeral services. Do I want burial? Do I want cremation? What type of things maybe do I want people to know about me after I'm gone? What kind of music to be played? And so, we've supported so many patients over the years, and I've really seen a sense of calmness with our patients that have completely laid this out. We've had patients that we've supported that literally had all the printed materials for their funeral ready to go. What's on there, what music, who they want to speak, who they want to share stories, and it's really a way to help people navigate their journey and feel in control. That's what hospice does, and that's what filling out a document like this, it puts the control in the hands of the patients and those closest to them so that they can have the most peace of mind when they're navigating their end-of-life journey.
Perfect. Wonderful. Now, so where could they find the 5 wishes if they wanted to look at this and review this and maybe complete it?
Yes. Well, we, being the provider here and Lenawee County and the surrounding community, we have these documents on hand, and so we have a lot of people that call us, and they stop in and pick up the document. We can send that to them. We have a PDF form that we can send that to them, or they can go to the website and pull it up. You can just search for 5 wishes, and then you can pull up the document there as well.
Perfect.
So once you have filled out the document, you do have to properly execute that, and it's quite easy. It doesn't have to be notarized, but you go through, you sign that. It does have to be witnessed, again, not necessarily by a notary, but you would not want the witness to be a close family member or the decision maker for these, or maybe somebody that you're setting up your estate to receive funds or items or things like that. You want that to be more like a friend or neighbor or an acquaintance or things like that. So you sign that with a witness, and then your patient advocate or your healthcare agent that you've set up here, they have to read the document and they have to sign that they are willing to accept these responsibilities. And you set that up with your first choice, and then if they're unable to make those decisions for you when that time comes, you have a couple of other successor decision makers, and they sign that as well. Once that is fully executed, and then you've had that witness, then you should save it, you should give it to those decision makers, and then of course make copies for your physician as well. Or your hospice, if you've signed into hospice at that time, make sure that they have that as well. And then there's even just a little cutout that you put in your wallet or in your purse or whatever that you carry with you, so that if something happens, people see that you have that, and then they know to seek that information out.
Perfect.
So the other thing that we had talked about earlier, Hospice of Lenawee adds 1 wish to this, and we talk about the 5 wishes plus 1, and that plus 1 wish is, how do I want to leave my legacy? So that helps people make their plans for maybe how they want to leave some of their resources so that they can keep giving back to their community, to their family, or leave their legacy with a nonprofit, so that the support that you gave your community while you're here can continue long after you're gone, leaving your legacy. And we are happy to talk about that and educate our community. In fact, coming up in April 16th is National Healthcare Decisions Day, and that's really a day that helps us, really motivates to get out there and partner with the community and educate that. And so we're going to be doing a couple of 5 wishes plus 1 presentations right around April 16th. And so we have one coming up on April 19th, and that's at 8 o'clock in the morning at Hospice of Lenawee, right at our beautiful campus there. And so if people want to hit that in the morning on their way to work, they can come get that education there on April 19th. And then the following week, if the morning one doesn't work for our community members, they could come on April 25th in the Tecumseh area to First Presbyterian Church in Tecumseh, and then we're going to be doing that same presentation, 5 wishes plus 1, at 5:30 in the evening.
Perfect. Oh, wonderful. In CNB Wealth Management, we like to tell people that we help people plan, prepare, and prosper. And what we mean by prosper is really give them peace of mind, not only with their financial, but with their legacy. And I think what hospice does is help people get peace of mind with the end-of-life process. And so really appreciate your time today. Appreciate the work that you and your hospice team does. And so appreciate you coming out.
Thank you, Christopher. We certainly appreciate partnering with you, educating our community. We get a lot of support from County National Bank, and it's a real pleasure to serve this community and come alongside each other to support our community members, and like you said, give them that peace of mind. So thanks for having us today.
Thanks so much.